I think I just cracked the code on how to solve America's healthcare crisis and poverty. We don't need more insurance companies. We don't need more government subsidies. We need a complete mindset shift. What if, instead of wasting billions of dollars on Medicaid, Medicare, and tax credits for things like EVs, child expenses, we use all that money and buy every single American a whole life insurance policy, something that actually builds value over time, covers catastrophic medical costs, and helps people grow real wealth generationally. Listen, I know it sounds radical until you run the numbers. Right now, the US spends $4.7 trillion a year on healthcare, and that's $14,500 per person, every man, woman, and child. If the government foots over $1.9 trillion in Medicare, Medicaid, CHIP, and ACA subsidies, private insurance still not helping. Often you have to pay your high deductible. And if you're healthy, that money disappears. You don't get any benefit from it. You don't own it and you can't touch it. It's not an asset. You're basically renting peace of mind from a company that profits when you stay sick or scared of being sick. But let's say the government used tariff revenue, defense spending, and eliminate the redundant health subsidies, and instead issued every legal born U.S. citizen a $250,000 whole life insurance policy starting at birth. A $250,000 whole life policy for a healthy 30-year-old costs about $4,800 a year for the next 20 years of that policy. Here's the math. 330 million people at $4,800 a year, that's $1.5 trillion a year for the next 20 years. That's less than what we currently spend on Medicaid and Medicare at $1.9 trillion. But here's the difference. Whole life policies build cash values. They can be borrowed against tax-free for catastrophic health events. They're assets, they're not expenses, and they don't expire when the fiscal year ends. And if you pass away, your family gets that fund. This isn't welfare, it's ownership. You don't have to get government handouts. You get your own financial tool. Where would the money come from? Easy. We already have it. Tariff revenues that Trump has proposed can bring in $200 to $300 billion annually. They don't know what to do with that money? I sure do. Replace Medicaid and Medicare and tax credits. Eliminating these bloated and easily abused programs would free up $1.9 trillion annually. So instead of paying bureaucrats and insurance middlemen, we pay for our own policy ownership. It adds up and it works. These changes cut out insurance companies who profit off of fear and non-use. So you don't have to have a Luigi Mangione. It eliminates wasteful government subsidies that disappear every year. We don't gotta do these budget deficits. It drives down healthcare prices because now you are your own insurer. It makes Americans healthier because you're gonna be mindful since it's actually affecting your own money. Gives every single citizen leverage. Now you can negotiate cash pricing. You could shop for better care. You could stop being at the mercy of hospital billing departments. This is personal responsibility, is financial literacy. It's a national security program through national health. If you agree, then let's get this to go viral. I want you to challenge the numbers and my theory. Tell me why this isn't gonna work. This plan is a real solution and nobody else is coming up with it. So share it, tag someone who's tired of paying for nothing, and let's make this idea too smart to ignore.